Hello everyone, I'm Dr. Kakuli Kumar. I'm a consultant gynecologist and obstetrician practicing in Kolkata. Let's talk about morning sickness of pregnancy. This is a feeling of intense nausea and the wanting to vomit in almost all pregnant women, which commonly happens in the first 3 or 4 months of pregnancy. This happens because of a hormone called HCG, which is secreted from the pregnancy area, and it is present in high quantities in the blood of all pregnant women. Therefore, almost the majority of pregnant women have morning sickness. The slightly bad news is it's not just restricted to the morning. It can happen at any time during the day, though it is very much more in the early part of the day. How do you cope with morning sickness? When you first wake up in the morning, avoid having anything heavy or sweet. Try and have a dry piece of toast, a cracker or a salty biscuit. In a lot of pregnant women, just the act of brushing their teeth may trigger vomiting. If that is the case with you, then use a bit of toothpaste on your index finger and brush with it, though using a toothbrush is definitely more preferable if you can tolerate it. Avoid having anything very sweet in the morning. Have your favorite beverage, which may be tea or coffee, and if you don't like the sugar in it, then you can cut that out. Try and have a sour drink like nimbu pani, fruit juices, and curd-based drinks such as chas and lassi can also be very refreshing. Avoid having 3 heavy meals during the day like breakfast, lunch and dinner. Break up your meals into small meals and snacks throughout the day. Because you're pregnant, you'll have to eat normal amounts of food, isn't it? Eat your favorite foods. Eat whatever you want to. The famous cravings for something khatta in pregnancy is actually genuine and it is safe. So you can eat pani puri, bhel puri, pav bhaji, whatever you want to, but try and avoid eating too much of it off the streets so that you don't have loose motions. If your cravings are intense, why don't you consider making these at home so that they are clean and hygienic? Now, morning sickness, as I have just said, happens because of a normal reason and hence it is normal and safe. It is not serious, though it can be very uncomfortable. When you see your gynecologist in the first visit for your pregnancy, which is usually 1.5 to 2 months of pregnancy, you will be prescribed some medicines for morning sickness. These are not just drugs to reduce the vomiting tendency, they also have a mixture of vitamins in them, so make sure you have these regularly. It is not serious unless it is so very bad that you can't eat or drink anything at all. You have the risk of getting dehydrated. If this happens to you, see your gynecologist urgently so that the correct treatment can be started without any delay. I will end with some good news for you that this too shall pass, because it happens only usually in the first 3 or 4 months of pregnancy. I'll be back soon with more health tips and measures. Until then, stay well, stay healthy and enjoy your pregnancy. Thank you.